Hello and welcome back everyone to the series of episodes on drugs that are used in arthroplasty patients. In this episode, we're going to learn about the peri-articular injections with local anesthesia as a part of multimodal approach to the management of joint arthroplasty pain. So there are multiple cocktails that are proposed in the literature, and here is an example of one of the cocktail using bupivacaine 2 mg per kg body weight, fentanyl 100 micrograms, methylprednisolone 40 mg, cefuroxime 750 mg, normal saline 25 ml. And the technique of periarticular injections is as follows. We use 18 to 25 gauge needles, and each pass of the injection should be to the appropriate depth and aspirate to ensure intravascular injection does not occur, and the injection has to be given slowly and continuously, and there should be at least a distance of 2.5 mm between two sides of the injections, and at each location around 1 to 2 ml of infiltration has to be given. And this pain control with periarticular injections is dependent on adequate tissue infiltration of this cocktail. So the first injection ideally be given after the femoral and tibial and patellar cuts and before the components have been inserted, and based on the different investigations on the nerve endings in and around the knee, the locations of this cocktail is determined. So the first injection is given in the following sites, that is in the ACL. The majority of the neural receptors are at the femoral attachment, and in the PCL at the tibial attachment the infiltration has to be given, followed by lateral femoral and tibial periosteum, then medial femoral and tibial periosteum. Then the second injection is after the placement of final components, and it is given at the arthrotomy and proximal extensor mechanism, patellar periosteum, retinaculum, anterior capsule and fat pad. And the third injection is a subcutaneous tissue and skin injection, and it has to be given perpendicular to the wound edge. So this is in brief about the technique of giving the periarticular local anesthetic infiltration. And it is also found that compression dressing improves efficacy of the local anesthesia that has been injected. So far, the periarticular injections have found to be effective. However, there would be some remote chance of adverse effects as well with these cocktails, and they can be neurovascular injuries. The popliteal artery would be 2 centimeters from the posterior capsule when the knee is in flexion, and it lies just lateral to the midline. So one has to be very cautious when infiltrating the posterior capsule not to injure the neurovascular bundle that are located posterior to the capsule. And one may also injure the peroneal nerve when giving the lateral periosteal injections, and there can also be adverse effects related to the drugs. There can be allergy to any of the components of these drugs, and sometimes these local anesthesia drugs in high doses, when it is given, they can also cause cardiac toxicity, renal dysfunction, seizures, gastrointestinal ulcerations and bleeding as well. So these are some of the adverse effects that can be seen with these local infiltration. So this is in brief about the local anesthesia injections as a part of multimodal pain control in total knee arthroplasty patients. Thank you.